Hello and welcome to the third episode of Straight Talk on Food and Health Communications, your number one go-to source for food and general health information. My name is Victor Wabari. Today being the 25th day of April 2022 marks World Malaria Day, a day set aside by the World Health Organization to sensitize the general public and to help them prevent the spread of malaria. And the theme for this year's World Malaria Day is harness innovation to reduce the malaria disease burden and save lives. Now, malaria is a disease caused by a parasite spread by a particular kind of mosquito, the anophelines. Most cases occur in Africa, and malaria is particularly harmful to young children. It is one of the most deadliest diseases on earth, and the World Health Organization estimates that 600,000 people die from it yearly. Nevertheless, malaria is preventable and curable, and the best way is to stop people from getting the disease by preventing them from being bitten by mosquitoes. But a vaccine would certainly be a more effective weapon against malaria. And the good news is that some researchers in Britain have developed a vaccine that is 77% successful in stopping infection in early clinical trials. With more on these, we are now being joined virtually by Dr. Paul Omachi. Dr. Paul Omachi is a medical doctor and senior registrar at Federal Medical Center, Bida, Niger State, Nigeria. Thank you very much for joining us on the platform, Doctor.
Thank you very much.
Now, what do you make of today being World Malaria Day?
Well, malaria has a very devastating impact on families, communities, and societies. And so, kudos to World Health Organization who have made today's 25th of April every year World Malaria Day to create a global awareness for the disease.
Now, Doctor, for the sake of our viewers, could you please explain to us what malaria is?
Yeah, malaria is simply a disease caused by a protozoan parasite called Plasmodium species. We have five of them. We have the Plasmodium falciparum, which is more common in sub-Saharan Africa and in Nigeria in particular. And it causes the most deadliest disease across the world. And then we have the Plasmodium vivax, which is the second commonest, and this occur in other countries outside of, sub-Saharan Africa, countries like that are found in Southeast Asia and in Latin America. The other species are the Plasmodium malariae, Plasmodium ovale, and Plasmodium nolense. All of these cause infection across the world.
Now, the theme for this year's World Malaria Day is very, very strategic, seeing that the World Health Organization has chosen to make the theme harness innovation to reduce the malaria disease burden and save lives. What would you make of the theme that the World Health Organization has chosen for this year's World Malaria Day?
The theme is apt and it drives home the message. WHO is playing an important role by asking investors and innovations to be made in new vector control programs. This might help in early diagnosis and help also in producing more anti-malaria medicine and tools to speed up the pace at which malaria is being eradicated.
I'll just read out some statistics here, which says malaria is one of the major health issues affecting many countries around the world. And we see that malaria kills over 500,000 people every year, with the estimated number of malaria deaths standing at 627,000 people in 2020. Now, doctor, why is malaria so deadly that it has this high number, ravishing lives every year? Why is it this deadly?
From the statistics that you have just given, you find out that 627,000 persons die annually from malaria infection. That shows how deadly malaria is. Now, according to the latest World Malaria Report, there are 241 million cases of malaria
That's right.
in 2020, and 95% of these occur in sub-Saharan Africa. 96% of deaths occur in sub-Saharan Africa, like you said, 627,000 deaths across the world. And out of this, 96% occur in sub-Saharan Africa. Children under the age of 5 account for 80% of all malaria deaths in Africa, and 4 African countries accounted for just over half of all malaria deaths in the world. And it will surprise you, Nigeria is the leading of these 4 countries. Nigeria has 31.9%,
That's right.
followed by the Democratic Republic of Congo, which is 13.2%, and then the United Republic of Tanzania, which is 4.1%, and Mozambique, which is 3.8%. Malaria is deadly because it has a very high transmissible rate, and it can occur, from one person to the other.
Now, doctor, according to data released by the US Embassy, we see that 97% of the Nigerian population are on the risk of malaria. Now, the question rises, why is malaria so rampant in Nigeria? And even from the statistics you just rolled out not too long, looking at the likes of Nigeria, DR Congo, and other African countries, we see that Nigeria is on the rise. Why is malaria so rampant in Nigeria?
Thank you very much. Nigeria is peculiar. We have, peculiar climates that help in keeping the parasite alive. The issue of flooding all over the, country, poor environmental sanitation across the country, poor socio-economic developments, and the gap in infrastructural development in the country. All of this has played a significant role in the burden of malaria in Nigeria. Apart from that, there is the overstretched healthcare system in Nigeria. The primary healthcare system is moribund or almost not functional. Hard to reach places like the rural areas where drugs and interventions cannot get to. All of this making the impact and the burden of malaria to be high in Nigeria. I must also talk about the displaced population from the effect of bandits, terrorism, which makes people to live where they are, to internally displace people's camps, where they are ravished by, mosquito bites and malaria. All of this makes malaria so rampant in Nigeria today.
It's still the program Straight Talk on Food and Health Communications, your number one go-to source for food and general health information. And we're still talking to Dr. Paul Omachi, a senior registrar at the Federal Medical Center, Bida, Niger State. Get your pulse here. You could be a part of the conversation. You could send an SMS to +2348109582742, +2348109582742. Now back to you, Dr. Paul Omachi. We see that the World Health Organization has recommended the widespread use of a vaccine against malaria. And it marks the world's first mass vaccination program against the disease. And it is set to prevent millions of children from catching malaria and thousands dying from this debilitating disease. Now, with the World Health Organization this week announcing a massive spread of the malaria vaccine across Africa, what do you make of this? Do you think that the World Health Organization is taking a massive step with the way we see the vaccine moving rampant across major countries in Africa?
Yeah, thank you very much. That's the way to go. WHO, the World Health Organization, is doing beautifully well. The campaign to roll out these vaccines will go a long way to reduce the burden of malaria across the world, and especially in sub-Saharan Africa and in Nigeria. That will help to reduce the burden of malaria, and will prevent infection, and on the long run would also help in eradicating the disease. Having said that, on our own part as the populace, we need to also ensure that we break the transmission of the disease. While the vaccines are coming, we should work on the vector and try and eradicate the vector. And all of this will help us to eradicate the disease.
And that drives me to my next question, which is very strategic, because if you look at the stats, we see that more than 1 million children in Ghana, Kenya, and Malawi, they've now received at least one dose of the first malaria vaccine. With Nigeria having the highest proportion of malaria deaths worldwide, standing at 31.9%, just like you said, why has the vaccine lingered in getting to Nigeria? Because as of last year, April 25th, which commemorated the World Malaria Day, we saw a circular by Voice of Nigeria telling us that it will take about 6 months' time for us to get the vaccine. But we are here now. This is 2022, and we've seen countries like Ghana, we've seen countries like Kenya and Malawi getting first dose of the malaria vaccine, whereas we, Nigeria, where the death rate is high, we've not seen the vaccine yet. What do you make of this, doctor?
Well, the countries you have mentioned, the vaccines were tried in those countries, and as reports come in to test the efficacy of the vaccine, you say 77% is efficacious. It's just a matter of time; it will get to Nigeria. I don't want to talk about the government policies and the bureaucracy of getting the vaccine to Nigeria, but I know that it's a matter of time it will get to Nigeria, and thank God for this year's theme, harnessing innovation to reduce the malaria disease burden and to save life, is key. And I hope that the Nigerian government will, key into this and make the vaccine available for its populace.
Now let's get some of the inputs from our viewers. We see some persons already sending in some SMS, and some persons are asking some questions. And Doctor, we'll have you react to these questions. We've got this message, and it reads: "Good day, Victor, and your guest. My name is Basi Emmanuel from Calabar, Nigeria. Can malaria spread from person to person?" This question is coming from Basi Emmanuel, all the way from Calabar. And we've got this one also. It reads: "Good day, Victor. I'm Mabel. I was born in a country where malaria is present and had malaria as a child, and then moved to the United States many years ago. Do I need to worry about getting malaria when I return home to visit my friends and relatives?" So what's your take on these two questions, doctor? The first person asking if malaria can spread from person to person, and the other person asking if, she was born in a country where there is malaria and then she's migrating back to the US. Does she need to worry about getting the malaria disease upon visits to her relations?
Yeah, the first question, malaria is not transmissible from person to person. You need a vector to carry it from one person to another, and that vector is the female anophelines mosquito, which picks the parasite from one person and transfers it to the other person. So without that vector, there cannot be transmission between one person to the other. So in simple terms, malaria cannot be transferred or transmitted from one person to the other. Yeah, my other friend who was born in a malaria endemic country and who traveled to the United States and has stayed there for quite some time. Well, she needs to worry by the time she's coming back for a visit because she's visiting an endemic region. She will need to, take preventive measures. Otherwise, she will come down with malaria. This is because over time that she's been away, she would have lost the herd immunity that people in high transmissible areas have. And because of that loss of immunity, by the time she comes back to this part of the world, she's at risk of, getting infected.
Do not forget, viewers, it's still Straight Talk on Food and Health Communications, and we are looking at World Malaria Day. And you can still be a part of the conversation. Send us an SMS to +234 8109 582742 +234 8109 582742. Back to you, doctor. Can you kindly talk to us on the importance of hygiene as it regards the eradication of malaria? The importance of hygiene as it regards the eradication of malaria.
Thank you very much. Hygiene in this regard would mean good environmental sanitation or good environmental hygiene. Now, from a triad perspective, which includes the agent, the host, and the environment, researchers have encouraged the source reduction and elimination of mosquitoes breeding sites, like flood areas, gutters, unused tires, around the house, bushes around the house, and all of that. They are good breeding sites for mosquitoes. All of those things should be cleared and kept clean. These tend to be essential because the proliferation of mosquito continually perpetuates the transmission of malaria. So we can postulate that if the source of mosquito breeding site is eradicated, then we'll be able to reduce the burden of malaria significantly. And so it's important that we begin to look at these areas and we begin to, try and ensure that there is good environmental sanitation. Many years ago, it was routine for the nation to set aside a day, usually Saturday, is it second or fourth Saturday of every month, where there is general sanitation. And as a child at that time, we know that you cannot go out before 10 a.m. But today we can no longer find all of those things. And even as a child at that time, we see light planes flying around and, spraying chemicals, to disinfect the environment. But these days, we cannot find all of that anymore. So good environmental sanitation is key in, preventing the spread of malaria parasite.
Now, doctor, you've been in the health sector, in the health system for quite a long time now. What would you say are the challenges, some of the challenges so far in eradicating malaria over the course of the debilitating and hindrance to eradicating malaria from our nation?
Thank you very much. There are so many challenges we're facing as individuals and even as a nation in eradicating malaria. It will interest you to know that malaria parasite can be eradicated. Countries have, done that before. Countries that have high burden of malaria, and by today they are regarded as low transmissible countries. Nigeria can achieve that, but there are so many challenges. I like the way Emmanuel Onal Ethor put it in 2016 when he tried to look at the challenges of eradicating malaria in Nigeria. He itemized them as one, inadequate healthcare infrastructure in the rural areas, poor drug distribution across the country, increases in drug-resistant parasites, increase in insecticide-resistant mosquitoes, poverty leading to poor construction of rural dwellings, and non-compliance with control programs by the populace. If we take them one by one, you'll find out that Nigeria is far behind. If we must, change the tide of things, we need to look at these things one by one. Inadequate healthcare infrastructure. You'll find out that the current healthcare system in the country is not enough to, take care of every person in the country. WHO says one doctor per 600 persons. I can show you that one doctor in Nigeria sees over 1,000 persons.
So, most definitely.
So that's really a challenge. The other challenge is the poor drug distribution. Anti-malaria, it will surprise you that in some rural areas, you can hardly find anti-malaria, good anti-malaria, in some rural areas. Reasons might just be because those areas are hard to reach.
Sorry to cut you short, because I want us to linger on this very point you just raised, talking about the anti-malaria drugs. Moving forward, enlighten our viewers on the use of anti-malaria drugs, because we see cases of where people feel they have malaria and they just, they storm the pharmacy, storm a clinic and get whatever they can get there and take the drugs 1-2 days and they feel they are okay and then they let the drugs go like that. Could you please, in just 2 minutes, enlighten our viewers on the use of anti-malaria drugs?
I must say that before the use of anti-malaria, one must be very sure that what one is having or the symptoms one is having is actually malaria. In our country today, once somebody has fever, the next thing is to take anti-malaria. That is not correct. The current national guideline entails that before you treat yourself for malaria, you must have tested for malaria. And if it is positive, then you now take anti-malaria. In children less than 5, there is a caveat that if the physician strongly thinks that the child has malaria, can go ahead to treat. Basically, the recommended or recommendation is that we should use artemisinin combination therapy. That's the
Mm,
recommendation. Oral and penicillin-based combination therapy.
mm.
For severe malaria, recommended that we should use intravenous artesunate for the treatment of malaria. This is the
Mm.
current guideline.
As we wind down to termination points on the program, I've got two questions here. One from Bukola Adeyemi from Lagos, Nigeria. She says, "Is it considered safe for me to breastfeed while taking an anti-malaria drug?" She's asking, "Is it considered safe for me to breastfeed while taking an anti-malaria drug?" And I've also got this question from Geoffrey from Canada. Geoffrey from Canada is asking, "Can I give blood if I have malaria?" Geoffrey is asking, "Can I give blood if I have malaria?" In 2 minutes, doctor, can you react to these two questions?
All right, thank you very much. Most of the anti-malarials are safe in lactating mothers. So there is no fear of breastfeeding while using anti-malaria because it's safe during breastfeeding. So nursing a child and you want to breastfeed and you are taking anti-malaria, you shouldn't be afraid. It's safe. Now the other question, well, yes, it can donate blood because malaria is treatable. So if you donate blood, the recipient of the blood will be treated for malaria. So it's not an absolute contraindication for blood donation. So you can actually donate.
Yeah. Okay, doctor, as we wind down on the program, what is the role of the government and the international communities in preventing malaria?
In programs like this, we are quick to ask and want to know what the role of the government is. But before I touch on that, let me also touch on the fact that we as populace, we have a role to play in
Mm,
the prevention of malaria. Like I've said before, good environmental sanitation, adherence to policies in the control and prevention of malaria as Nigerians is very, very important. And then the appropriate use of drugs in the treatment of malaria. People should not use drug indiscriminately because I told you
yes.
that one of the challenges is that we can have drug resistant malaria parasite. People
Yes.
should use drugs as at when, and they should use it in the proper way. And then also, people should be ready for the vaccine. There should not be vaccine apathy, when the vaccine eventually come, to the country. Now,
Mm,
coming to your question, the role of government and international communities in preventing malaria. Like I said in passing, the government has a lot of role to play. If you look at the challenges, the government needs to provide adequate healthcare infrastructure. The
mm,
government needs to provide more healthcare personnel to be able to attend to people who are sick. The government should also institute policies for the proper distribution of drugs across the country. And then also there should be sponsors of research, okay,
mm.
research in the country to tackle the problem of malaria. Also, poverty alleviation, which is key. There are a lot of people who are living, under the poverty line. The government should see to that and ensure that these people are brought out of poverty. Some
That's right.
people have malaria, they want to get to hospital, but the fund is not just there. And you can imagine what the end result will be.
Hey.
And so infrastructure, good roads, good drainage system, clearing of bushes,
Mm,
intermittent spraying of insecticides to, control the vectors and making provision, innovations, rapid diagnostic kits for the diagnosis of malaria and the vaccine that we talked about. Government should make sure that these vaccines are brought to the country and is
mm.
being used judicially. Thank you.
Do you think we are far from achieving a malaria-free world?
No, 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 no. Like I said before, malaria is a disease that can easily be eradicated. If we
Mm,
deal with the vector, we will be able to eradicate malaria. Just like chickenpox that have been eradicated,
That's right.
malaria can actually be eradicated. We can live a malaria-free world.
Thank you very much, Doctor. What are your final words on the program?
Yeah, thank you so much for the opportunity granted to me to, contribute in this World Malaria Day. I also want to lend my voice that we should take malaria serious. It's ravaging the world, ravaging sub-Saharan Africa and Nigeria, and most especially under 5 children. We should ensure that we look at these things. I want to also plead with the government. We are spending so much on COVID and less on the diseases that kill our people. I think the government should put more budgetary allocation in the fight of malaria and Lassa fever. Thank you.
And that's about the size of the program. And it's been Straight Talk on Food and Health Communications, your number one go-to source for food and general health information. And we've been speaking to our guest, Dr. Paul Omachi, who is a medical doctor and senior registrar at Federal Medical Center, Bida, Niger State, Nigeria. Thank you very much, Doctor, for joining us today. We so much appreciate and crave all that you've shared on the platform today.
Thank you. Thank
And
you
this
very
is
much.
how we round off on the program. Do well to join us on our next episode of Straight Talk on Food and Health Communications. Till we come your way next time, my name is Victor Wabari. Please do well to subscribe to our YouTube channel. Thank you very much. Till we come your way next time, we say keep staying healthy.